welcome to Inspira's Airway and COVID management of a patient update. The video is going to go over a couple different aspects of airway management with a COVID confirmed or potential patient. So what you see with our patient now is we're going to assume that the patient needed to be RSI. So we're doing our pre-oxygenation with a non-rebreather, pending that they had an appropriate respiratory status, or at least one that can pre-oxygenate themselves. So we have the non-rebreather, we also have the procedure mask. For all of the procedures, Brian is in appropriate PPE. This video doesn't go into donning or doffing or what the appropriate PPE is. This is mainly just the airway management aspect of it. Myself, for this video, I just have the mask because I'm just going to be orating for you. So we have a couple different new devices that Inspira is putting out that we're going to look at. We're all familiar with our BVM. We're familiar with the viral filters that have been coming out and our end-tidal CO2. Now this viral filter looks a little different than this, but it all depends on what the stock is, what potential shortages may be, or what we can even get our hands on. So they all operate the same, but they're a little different in look. Okay. We have our backup airways. We have the King Airway here, which our project is very familiar with. The other new aspect is going to be the inline suction. All right, it comes in a plastic pack. You rip open a couple different pieces to it. So what this does is it suctions completely through the endotracheal tube, keeps a closed system, and we're going to go into that a little bit later as well. So for our purposes, we've established that RSI needs to happen. We've given the appropriate meds. You've contacted the medical command physician, and so on and so forth. And at this point, because of our protocol, it's one person in the back of the ambulance or in an open area, wherever you're intubating, to limit the exposure of the employees. You're going to see Brian do everything by himself. All right, our video laryngoscopy systems is the King Vision. You just grab that real quick. We use a King Vision. Somebody may use something a little different. It all depends, but video laryngoscopy has become the gold standard for a COVID patient because it helps minimize that aerosolization of potential airway particles. One of the other pieces that you're going to see is a plastic sheet. All right, this comes up and over the patient, covers the airway, covers the patient, almost like a giant blanket. Right, and what this does is creates that extra barrier between the patient's airway and potential airway and mucus and aerosolization and our provider themselves. So Brian's going to go ahead and proceed with the intubation, removes the non-rebreather and the procedure mask, uses our King Vision. Now this is a very well lit room and there's no glare on the plastic. It doesn't inhibit his vision at all. He successfully intubates the patient. Inflates the balloon as you normally would. At this point he attaches the BVM with the viral filter and the end-tidal. And for our purposes, we have the lungs exposed so that we can show you another new piece of equipment that we have is the Dravon clamp. So what we're going to do is inflate the balloon, or inflate, good, and then you're going to clamp off. And what this is showing you is it retains this PEEP and alveolar retention. Okay, now this is a closed system, so nothing more can come into his face. You have about 20-30 seconds. He then secures the tube. Now this is our inline suction. Goes on completely. This white port is where your ventilatory circuit is going to come from. So whether that's a BVM or in hospital, that's your actual vent circuit, or for SCT, that's our Revel circuit. This is where it attaches. So okay, right. We have this corrugated tubing, which helps release some of the pressure on the tube itself so it doesn't move around, helping to make sure we don't dislodge it. Okay, so now we have our ventilatory circuit, our end-tidal CO2, our viral filter, little piece of corrugated tubing, and now our actual tube itself. Good. And now we go back to ventilation, and we are completely still in a closed circuit here. Now when it comes time to suction, on here, this hooks right up to your normal suction tubing, and this is our on-off. Okay, so we put it on, you would suction just like you normally would, slide it down until you meet your resistance. Now it's a mannequin, so we don't have resistance. Suction, so forth on the way out. This keeps it completely contained in here. Okay. Now for our SCT people in hospital, our new policy, what it's going to be is if you have someone on a vent circuit in the hospital, hopefully this system's probably already there. And then what you're going to do is you would use the Dravon clamps in between their system and yours. So you use the clamp, you clamp it off, make sure it's on one of the inspiration breaths that they're going to give. Then attach our Rebel, take the clamp off, and allow it to continue to breathe. It's just an extra step that we want to do to help minimize exposure for our employees. On the pre-hospital side, the ALS side, we're going to use the setup just how we see it here. And then you would go through all your intubation confirmation methods like you normally would. You want negative epigastric sounds, positive lung fields equal throughout both sides. We'll make sure we didn't go too deep. We're also going to look for a positive end-tidal CO2 waveform. If you have a pulse ox attached, you want to try and get a pleth waveform if you can, which our monitors do it, so that we can confirm it's accurate. In addition to that, always keep the DOPE mnemonic in the back of your head. So you have displacement, which happens with the tube. You have obstruction, which is what we have the suction for if we get a mucus plug. Potential pneumo, anytime you introduce positive pressure into injured lungs or sick lungs like that, we always have to worry about a pneumo. And then equipment failure. Keep that in the back of your mind as well. So this has been Inspira's Airway and COVID update video. If you have any questions, please feel free to reach out. Thank you.